So, Dr. Crawford, an immunotherapy agent was approved in April of 2010. Can you tell us a little bit about that?
Sure. You know, just echo what you said, too, about cytotoxic chemotherapy. If you ask a patient what he would rather have, an immunotherapy or some of these other new drugs, you know, it's a no-brainer. They're going to say that I would rather have that than cytotoxic chemotherapy. And so this whole thing is changing right now, the paradigm. And it is an exciting time with 7 new drugs that are all different. So we're beginning to talk about those. The first one I'm going to talk about is a drug called sipuleucel-T. And, you know, we've been trying to harness the immune system in cancer for, you know, 100 years or so, and goes way back to Coley's toxin and vaccines and everything else that have been around. And there was a lot of excitement, but nothing ever was approved until, as you mentioned, in 2010 roughly, the first effective immunotherapeutic treatment for a cancer, and that was prostate cancer. And so what is this? There's some unique things about prostate. One is that we have some antigens that are present. We have some proteins, prostatic acid phosphatase, PSA. And the other thing is you don't really need your prostate. So you could develop an antibody or something to destroy the prostate and get rid of it, and the cancer, it would be great. And you can't do that with liver or colon and other things like that, where you can destroy the whole organ. So what was found is that you can actually harvest something called your antigen-presenting cells, which process antigens, and then you can prime those with something unique for the prostate. It's called PAP, or prostatic acid phosphatase, and then juice up these cells with something called GM-CSF to also make them grow. And so what you do is you pherese these cells from somebody's blood, you send them to a processing place, you grow them up with these antigens, and then you give them back to a patient. This is a very expensive and time-consuming process, but it's one that was rewarding. And the large trial that was done was called the IMPACT trial in men who were advanced prostate cancer, castrate-resistant, which means they weren't responding to the normal androgens anymore, and had no or minimal symptoms, that there was a survival benefit of 4 months. And so this kind of set the landscape for this new treatment. And the exciting thing is that we're beginning to understand now is that immunotherapy works better earlier rather than later. So this is an early therapy. And as a matter of fact, we just looked at some data about men who had PSAs that were in the very low, that the survival benefit was not 4 months, but it was 18 months. And so it's new and exciting, and it's one of the drugs we have right now, or treatments we have, to offer patients that have advanced prostate cancer and improve their outcome.
Right. It is the first FDA approved, it's the first immunotherapy, therapeutic vaccine, if you will. And again, I agree. I think people were having a better understanding of the role of the immune system, not only as it relates to the pathogenesis of cancers, but obviously I think there was an opportunity here for actual treatment and therapy. So sipuleucel-T was approved by the FDA in April of 2010, I believe. It had a survival benefit versus the control group of about 4.1 months. And then, again, literally, what has happened is that there has been this rapid explosion of other therapies, and again, different from what we've had in the past. Again, the traditional intravenous cytotoxic chemotherapy. Now we've got two new oral agents that work on a hormonal basis. So, David, if you could update us on those two.
So we had called resistant prostate cancer hormone refractory or hormone resistant prostate cancer. And several years ago, probably about 8 or 9 years ago, we changed the name, because what became evident was that androgen receptor signaling, where traditionally we'd taken away one of man's favourite toys, testosterone, as a treatment for prostate cancer, the androgen receptor signaling actually was able to revitalise and reactivate in the cancer in that low testosterone state. And so we then began to call it castration-resistant prostate cancer. And that scientific concept led to the development of other drugs. One set of drugs to inhibit the metabolism of androgens within the prostate cancer cell, led by abiraterone, and a more efficient inhibition of the androgen receptor led by enzalutamide that resulted in a more efficient binding of androgen receptor and inhibition of the androgen receptor complex to going into the nucleus, and then in the nucleus where it tells prostate cancer cells to proliferate, an inhibition of binding of a variety of cofactors that inhibited it. So those two drugs move forward. In terms of abiraterone, we had two studies one done in a phase 3 setting after docetaxel chemotherapy and one done before. And the drug manufacturers started at the end because it was easier to get an overall survival advantage. And so with the Cougar 301 study, which was done after docetaxel, there was a significant overall survival advantage in the study of about 4 months that led to that drug being approved. And then the Cougar 302 study showed that there was delay of progression of disease before docetaxel with the same agent. In a similar setting, we had studies done with the androgen receptor antagonist enzalutamide, and the initial study called AFFIRM was a phase 3 study done after docetaxel, once again showed an overall survival advantage of in excess of 4 months and led to the approval of that drug in 2012. And then more recent data in the form of a press release, we haven't had the full data presented yet, for the PREVAIL trial, which is the enzalutamide trial before docetaxel, demonstrating that there is both a progression-free and overall survival advantage to this drug. So we have two new hormonal agents, the first really in their class, that have come through that are going to be used both before and after docetaxel. They're oral and they're hormonal agents.